here today at San Gabriel Valley Medical Center, the emergency department. I'm here with Joe Wolf. Joe, how are you?
I'm doing pretty good. How are you doing today?
Very good, very good. We've got a lot to learn today about the emergency department, how it's changing here at San Gabriel Valley Medical Center. But first, I want to find out a little about you, Joe. You're going to take me around, give me a tour. Tell us a little about yourself.
Awesome. Well, I'm going to be the nursing leadership over here at San Gabriel Valley Medical Center Emergency Department. And what that kind of means is I come with, obviously I got a master's degree before I did this. Additionally, I've been over multiple emergency departments in the past, kind of help them grow, help their population grow as well. So about 6 years or so in healthcare myself. And going to be very excited to get on with this team and very excited to get on with this new medical director.
First, some general information for our viewers. You need to know that if you have a problem, don't worry about COVID anymore. You can get the help you need right away, and don't delay. Correct me if I'm wrong, the longer they delay, the more serious it's going to be.
Yes, and that's what we've really been seeing is a lot of people will stay home when they have things like chest pain, abdominal pain, different symptoms like that, and they'll stay home because they get scared that they're not going to be able to get the treatment they need or that there's going to be a lot of COVID in the emergency department. We isolate patients with those types of symptoms. We have open beds as well. We're ready and we're willing to take you, and it's better to come in now than to wait on it because it only gets worse. One thing we prioritize and we push here is getting patients not only triaged, but seen by a doctor as quick as we can. I mean, our goal is about 15 minutes for that, and additionally to get them back into a room where they can get treated. That's not something we deal with too much over here, and that's really the push that we have coming on as leadership over this emergency department. Additionally, our nurses speak multiple languages as well, and we're ready to treat any type of patient that comes in.
Dr. Kwan is the new director of the ER. Dr. Kwan, it's changed a lot since I was last here. What are some of the changes going on?
So the main change is going to be efficiency. We're hoping to serve the community in a very timely fashion. We're hoping that the wait time is less than 5 to 10 minutes before you get to see a physician or a nurse. Our department's open 24/7, 365 days a year. I want to let everyone know that regardless of what your complaint is, nausea, vomiting, abdominal pain, or if your kids have a fever at 3 o'clock in the morning, we're here for everything. Our physicians are all board certified emergency physicians. We are trained to recognize the sick, the ill, and we're also trained to reassure the not so sick, and so that you can go home with reassurance. Don't be afraid to come to the emergency room regardless of your complaint. It could be subtle signs of something serious. A simple headache could be a stroke. A chest pain could be a heart attack.
Yeah.
So we're always here, and our job, and we're trained to pick up these severe illnesses. So I ask that you put the trust into us, and we will return it with proper diagnosis and reassure, and also efficiency, so that your loved ones are reassured and treated. We want to be your neighbor. We want to be the neighbor that's always there, that you can always trust and you can always turn to.
In the emergency department, there's multiple areas where you can get treatment. This is called the main emergency department. This is where you're going to be if you require more lab work, more testing, and more x-rays, or require some type of isolation.
All right, so if you watch the television shows about emergency departments, this is probably what you're looking at.
Oh,
right?
yes,
right?
100%, 100%.
Okay. But keep in mind, that means it's going to take more time, right, for the x-rays or
Typically, you're going to have patients that require more of a workup, more of an assessment by the doctor and assessment by the nurse as well.
Okay, so that front area we were at earlier, that would be more for just your knee injuries, simple illnesses?
Yes, yes. So that's going to be really a lot of the focus here is getting these patients that maybe they have a knee injury, maybe they need a med refill, any number of things, a simple repair of a wound. They're actually going to go up to a different area, which we call the fast track. They'll be seen at triage and put into a different area.
So the fast track is probably for your more common injuries, more common illnesses. That's really good news, because if you've got a pediatric issue, would that be also the
Yes, yes, a pediatric issue, anything like that, still a private space, still get seen by a doctor, but you get out a lot faster because you're in that front area.
Earlier, you mentioned the fast track room. Is that where we're at right now? Is this the fast track room?
Yeah, this is the fast track room. So this is a good example of what you're going to see if you go to triage and go to this fast track area rather than that main emergency department. Back here, you're going to see things like crutches. You'll see the suture card over here to help any type of wound, fix up anything like that. Additionally, ways to check the ears and the nose as well.
Okay, so things like crutches, they're going to be able to get here, but not x-rays, labs, that would be the main.
They'll be able to get simple x-rays. Say when you use crutches, you'll get a simple x-ray, but say we need anything like a CT or multiple radiology exams, we'll end up moving to the back. But up here, I mean, that's still a pretty simple exam for the fast track.
Okay, so looking around it seems like you can come in, you know you're going to get fast service. If you have something that's not requiring a major lab report, you're going to be able to get quick treatment right here.
Oh, yes, 100%. We're going to see patients very quickly here, patients that have very maybe minor injuries or not as many interventions needed. Be able to see very quickly back here in the same kind of location as you would see in the main emergency department. You'll just be seen a lot faster and get out of here a lot faster.
All right, and about what's the time frame? You're trying to get people within how many minutes?
So the time frame is really getting a patient right when they enter the door. We want them to be able to see a medical personnel. We want to see someone on the staff with us, but within the first 15 minutes is the goal to get them not only triaged, but also seen by a doctor and get us right back to if a fast track room or even a main emergency department room if we need it.
Okay, so wonderful. So keep in mind, there's a fast track room, there's a main emergency department room, whatever you want to call it. All right, so you can get your treatment fast if it's nothing that's really, really complicated.
San Gabriel is ready for all of the emergencies and urgencies as well.